Continuation of the previous video about respiration. Next, lung stretch receptors. Located in the lung tissue, stretch receptors respond to the degree of lung inflation. When the lungs are overly inflated, these receptors send inhibitory signals to the medullary respiratory centers, causing in the respiratory rate and preventing overinflation. Irritant receptors, which we have already learned, but we will be learning once again, found in airways. Irritant receptors respond to irritating substances such as dust or chemical irritants. When stimulated, they initiate reflexes that can cause bronchoconstriction, coughing, or change in respiratory rate to protect the lungs. Then emotional and behavioral factors. Emotional states, stress, anxiety, and physical activities can all influence respiration. For example, fear or anxiety can increase the respiratory rate and depth, while relaxation or meditation techniques can slow down breathing. Examples: exercise. During physical exercise, the body's oxygen demands increase, leading to an increase in breathing rate and depth to deliver more oxygen to the muscles and remove excess carbon dioxide. Then high altitude. At high altitudes where oxygen levels are lower, the body responds by increasing the respiratory rate and depth to compensate for the reduced availability of oxygen. Then respiratory diseases. Conditions such as asthma or chronic obstructive pulmonary disease or COPD can alter the normal regulation of respiration, leading to symptoms like shortness of breath or difficulty breathing. Then importance: gas exchange. Proper regulation of respiration ensures an adequate supply of oxygen to the tissues and the removal of carbon dioxide, maintaining optimal gas exchange and supporting cellular function. Now let's learn some foods for better respiratory system. Fruits and vegetables. Rich in antioxidants and vitamins, fruits and vegetables provide essential nutrients for respiratory health. Examples include berries, blueberries, strawberries, raspberries. Then citrus fruits, oranges, lemons, grapefruits. Then leafy greens like spinach, kale, Swiss chard. Then cruciferous vegetables like broccoli, cauliflowers, Brussels sprouts, bell peppers, tomatoes. Omega-3 fatty acids have anti-inflammatory properties and may help reduce respiratory inflammation. Sources include fatty fish, salmon, mackerel, sardines, chia seeds, flax seeds, walnuts. Vitamin C rich foods. Vitamin C supports immune function and may help reduce the severity and duration of respiratory infections. Foods high in vitamin C include citrus fruits, oranges, grapefruits, then kiwi, strawberries, bell peppers, broccoli, garlic, and onions. These pungent vegetables contain compounds that have antibacterial and antiviral properties which can support respiratory health. Ginger has anti-inflammatory properties and may help alleviate respiratory symptoms. It can be consumed fresh as a tea or added to dishes. Then green tea. Green tea is rich in antioxidants and may have anti-inflammatory effects which can benefit the respiratory system. Then turmeric. Turmeric contains curcumin, a compound with anti-inflammatory and antioxidant properties. It may help reduce respiratory inflammation and support lung health. Then nuts and seeds. Nuts and seeds are a good source of vitamin E, which is an antioxidant that may help protect lung tissues. Examples include almonds, sunflower seeds, and hazelnuts. Then probiotic foods. Probiotics promote a healthy gut microbiome, which can indirectly support respiratory health. Examples include yogurt, kefir, and kimchi. Then water. Staying hydrated is important for maintaining optimal respiratory function. It helps thin mucus secretions and keeps the airway moist. It is important to note that individual dietary needs may vary, and it's always best to consult a healthcare professional or registered dietitian for personalized dietary recommendations. Additionally, a balanced diet should be complemented with regular physical activity, sufficient sleep, and avoidance of smoking or exposure to secondhand smoke or optimal respiratory health. Major diseases related to respiratory system. Asthma. Symptoms: wheezing, shortness of breath, chest tightness, coughing. Treatment: inhalers like bronchodilators and anti-inflammatory medications, avoiding triggers, managing allergies, lifestyle changes, chronic obstructive pulmonary disease or COPD, symptoms shortness of breath, chronic cough, wheezing, frequent respiratory infections, treatment like bronchodilators, inhaled corticosteroids, pulmonary rehabilitation, oxygen therapy, smoking cessation, then pneumonia, symptoms cough, fever, chest pain, difficulty breathing, fatigue, treatment antibiotics if bacterial pneumonia, antiviral medications if viral pneumonia, rest, fluid, supportive care, tuberculosis or TB, symptoms persistent cough, chest pain, fatigue, weight loss, night sweats, treatment antibiotics, multiple medications for an extended duration, isolation, directly observed therapy or DOT. Then lung cancer, symptoms persistent cough, chest pain, shortness of breath, coughing up blood, weight loss, treatment surgery, chemotherapy, radiation therapy, targeted therapy, immunotherapy. Then pulmonary embolism, symptoms sudden onset of chest pain, shortness of breath, rapid breathing, coughing up blood, anticoagulant medications, thrombolytic therapy, vena cava filter, supportive care. Then sleep apnea, symptoms loud snoring, excessive daytime sleepiness, pauses in breathing during sleep, morning headaches, continuous positive airway pressure, CPAP therapy, oral appliances, lifestyle changes, weight management. That's uh, something about sleep apnea. Then bronchitis symptoms persistent cough, mucus production, chest discomfort, wheezing, treatment rust, fluids, over the counter cough suppressants, bronchodilators, then antibiotics if bacterial bronchitis, then cystic fibrosis symptoms persistent cough, recurrent lung infections, wheezing, poor weight gain, salty tasting skin. Then treatment airway clearance techniques, medications like mucolytics and bronchodilators, antibiotics, nutritional support, allergic rhinitis symptoms sneezing, runny nose, congestion, itchy or watery eyes, post-nasal drip. Then avoiding allergens, antihistamines, nasal corticosteroids, immunotherapy. It is important to note that the treatment and management of these respiratory diseases can vary depending on the specific condition and individual factors. Treatment should always be guided by healthcare professionals and tailored to each person's needs. Early diagnosis, proper care, lifestyle medications, and avoiding preventative measures can help improve outcomes and manage respiratory diseases effectively. So, what should I do for a better respiratory system? To maintain a healthy respiratory system, you can follow these tips. Don't smoke. Smoking damages the lungs and increases the risk of respiratory diseases. Quitting smoking is the most important step you can take for better respiratory health. Avoid exposure to pollutants. Minimize exposure to secondhand smoke, air pollution, chemicals, or other irritants that can harm the lungs. Then practice good hygiene. Wash your hands regularly to prevent the spread of respiratory infections. Then exercise regularly. Physical activity helps improve lung capacity and overall respiratory function. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Then maintain a healthy weight. Obesity can strain the respiratory system. Adopt a balanced diet and engage in regular physical activity to achieve and maintain healthy weight. Stay hydrated. Then practice deep breathing exercise. Deep breathing exercises can help improve lung capacity and strengthen the respiratory muscles. Try techniques like diaphragmatic breathing or pursed lip breathing. Avoid respiratory irritants. Be cautious around substances that can irritate the respiratory system, such as strong chemicals, dust, and strong odors. Then get vaccinated. Follow recommended vaccination schedules, including vaccinations against influenza and pneumonia to protect against respiratory infections. Then practice good indoor air quality. Ensure proper ventilation in your home and workplace. Use air purifiers if needed and keep indoor humidity levels in optimal range. Then manage stress. Chronic stress can negatively impact the respiratory system. Find healthy ways to manage stress, such as engaging in relaxation techniques or pursuing hobbies. Then get regular checkups. Visit your healthcare provider for routine checkups and screening to deter detect any respiratory issues early on. Remember, maintaining a healthy lifestyle overall contributes to better respiratory health. It's important to consult with a healthcare professional for personalized advice based on your specific needs and medical history. So that's all about this topic of respiratory system. We have learned many important points related to this topic, like surfactant, what is surfactant, various respiratory capacities and volumes, then some major diseases associated with malfunctioning of respiration, and how to increase the health of respiratory system. So that's all about this topic. Thank you for listening.